According to the World Health Organization, in 2022, approximately 2.3 million women were diagnosed with breast cancer, and another 670,000 died from the disease. While the 5-year survival rates for breast cancer in high-income countries exceeds 90%, the figures dropped to 66% in India and 40% in South Africa. Today marks World Cancer Day today, a day that raises awareness about the importance of health promotion, early detection and timely diagnosis linked to comprehensive treatment. This morning we focus more on understanding prevention and the support of breast cancer interventions that are being made in the country. We are joined in studio by Renata Maharaj, Head of Medical Affairs at Novartis South Africa. Doctor, it's a pleasure to have you and thank you so much for coming in.
Thank you so much, and it's an absolute pleasure and delight to be here this morning.
Frightening reading the statistics that I read in the opening of this interview, and although there's been a lot of public awareness, there's education programs on breast cancer, but there's still a lot that might not be understood about breast cancer. Can you perhaps explain in simple terms what breast cancer is and the different types of breast cancers that you actually get?
Yeah, so breast cancer, I think, just in a really basic form of explanation, it is just think of an abnormal cell that is within your body that grows exponentially. It's also a disease that's under an umbrella because there are different subtypes or different classifications. And if we had to look at the location of describing where the breast cancer is to determine the type of breast cancer, you get breast cancer that remains within a space, and that's we refer to as your non-invasive, and it hasn't spread anywhere. And that's within the ducts. So ducts are these little channels in the body, in the breast glands, that actually carry milk. And then we have lobules, which are what produces the milk. So cancer can begin there, either in the ducts or in the lobules. And we get the forms what we refer to as a ductal carcinoma in situ and a lobular carcinoma in situ. Now, when this begins to spread, and this can spread either to the lymph nodes within the body, the surrounding tissue, and even as far as to distal or far organs in the body as well. And this is what we refer to as your invasive cancers, which is the most common type that we see here, and the prognosis being rather poor.
And we
can further classify this, and I think this is the beauty of innovation that lies within the sphere of medicine, is that we look at actual receptors or the biological and molecular footprint of the tumor to determine whether it is positive for hormones. So we look at your estrogen receptors, your progesterone receptors, and a protein that's called HER2. So one may hear the diagnosis from their doctor of a hormone receptor positive, HER2 negative, hormone receptor positive, HER2 positive, or if it has none of these, then it's the triple negative. So it can get really complicated on a molecular level, but yeah.
It certainly can, and you sit there as an individual being diagnosed with this, and you have no idea what's going on, and that's the reality, and that's why it's important to get these explanations so that, you know, this information is powerful to you. But I think what's more powerful is early detection, and that is what we are told from the earliest of ages. And I want to go there. When? When should we start going and checking annually? At what age should we start looking? All these kind of things when we say early detection.
Yeah. So actually every female and male, because males also do get breast cancer, should be having a self-breast examination on a monthly basis. So the onus lies upon us as individuals to take care of our own health, our own bodies, and pay attention to the changes that occur. So a self-breast examination is highly recommended on a monthly basis. Mammograms is the gold standard for screening of breast cancer, and the recommendations by the WHO and several other medical publications and boards that sit together is really from the age of 40, is that a woman should have a mammogram done on an annual basis. However, earlier screening is required in ladies that are younger, that have high risk factors. And high risk factors would mean you ladies that have a positive family history. So a mom, a grandmom that's had breast cancer, or like we've modified, right? So we can actually test for genetic mutations. If you harbor a specific mutation like a BRCA1 or BRCA2, then screening has to begin much earlier. From the age of 25 is the recommended age.
Wow. Okay. So, I mean, this is the gold standard, as you said. But the reality is that medical aids don't necessarily see it that way. They keep telling you 2 years. But that's for people that are fortunate enough to be on a medical aid, because, you know, the majority of people are not on a medical aid. And then access to treatment becomes a very contentious issue, and that's a problem. How should we address that?
Yeah, and I think there is no sole entity that can address the healthcare challenges within South Africa. It's a call to action of all of us, individuals, organizations, the government, and coming together. And I think improving detection would be on a multifactorial level. So first it would begin with increase in the awareness and education that exists out there, because we need to actually detect the cancer first. Secondly would be to increase infrastructure development, and can only come through with partnerships. So the likes of your private-public partnerships, and that we stand together to harbor and increase infrastructure research within the country and data surveillance as well within the country, and to break the stigmas within communities. This is not going to be a one-person show. It's going to be a call of action where it is, if we come together, there can certainly be a profound action. I think silo mentalities are definitely not going to work. I want
to dig into these common myths and perhaps stigmas and misconceptions around breast cancer. Talk me through this. What is out there? Let's talk about that.
Yes, I think one of the hugest myths is actually that breast cancer is the death sentence, because if we look at the innovation and the change in the paradigm of treatment over the 2 decades, it certainly isn't a death sentence. And as you mentioned earlier, the mortality rates of people that are dying when detected early is way less than those that are detected late. So if we look at 5-year survival in your early breast cancer, for instance, it's above the 90% mark. Whereas if we look at it in your metastatic, which is your stage 3 and 4 patients, it drops right down to a 29% survival risk.
Sure. Okay.
So I think that is one of the hugest ones. The other is that only old women get breast cancer, and this is definitely untrue, because there is a significant trend that we're seeing even amongst the South African populations of women in their 30s and 40s that are currently being diagnosed with breast cancer. Actually, the youngest South African breast cancer patient is a 12-year-old child.
Oh my goodness.
So it's certainly not a disease for the older only.
That's crazy.
Yeah.
Is there a certain cutoff age? I mean, and I say that, it's something I've heard. Maybe once you've turned 75, your risk drops quite substantially. Is that true or not really?
I don't think that is true,
okay.
Because...
So you, no matter what age, you
yes.
still have to go for those tests, examinations, all of that.
Exactly, and actually the older you get, the higher the risk is.
Oh, wow. Okay, so there you go. Myth gone. That's a big one. I mean, when we look at these stats, which I spoke about at the World Health Organization, while the 5-year survival rates for breast cancer in high-income countries exceeds 90%, that figure drops when we come here to South Africa. 40% in South Africa. From the latest data that we can see, can you perhaps have a look at which population groups are most at risk when it comes to developing breast cancer?
Yeah, so I think the current trends, if we look at it from a race perspective, is that Caucasian women or white women are actually at highest risk of developing breast cancer. There is a significant trend in an increase in breast cancer amongst the black population, but one also needs to pay attention to the urban and the rural diagnosis and screening and how much of access one has. So how true is our data within the country? So what we currently are seeing is that there is an increase in the urban population of breast cancer reports, rural populations lower, but this is not a true incidence because
absolutely
rural women do not have access to healthcare
definitely
as equitable as the urban areas do.
Lifestyle. I want to quickly get there. I know we don't have too much time, so I really want to get as much as I can in. Lifestyles. What has been found to contribute towards breast cancer? Obviously, we've spoken about hereditary factors, but lifestyle?
Yeah, I think, and this is something that is within the hands of every individual in South Africa, is taking care of your weight. So maintaining a good BMI and a healthy lifestyle, so choosing the right kinds of foods to eat, staying away from the excessive amounts of sugar, alcohol, smoking, and and really a less sedentary lifestyle, so getting as active as possible, are simple initiatives that actually don't cost much and don't cost anything actually,
Yeah.
but can make a difference significantly in your treatment outcomes.
And finally, as we sort of wrap this up, I mean, there are many, many challenges, and say you are diagnosed with some form of cancer. We're focusing obviously on breast cancer here. This affects your ability to work. It affects your ability to earn an income. What are some of the most important things that you would like to emphasize for both sort of a work environment to support a patient, for communities to support a patient, you know, all of these kind of networks that need to be in place?
Yeah. So I think on an individual level is really getting to know the facts and breaking the myths. How communities play a role is really demythifying the myths and really emphasizing awareness and education from a community basis, and just getting rid of the stigma about talking of breast cancer within communities itself. Organizations can do a similar drive in terms of education, and I think the financial burden that lies within organizations, we need to think a bit long term of the financial burden. So giving individuals time off to get a screening done while it's in an early stage versus a woman who may present later and may never turn up to work post that. A simple initiative. So awareness, awareness, awareness.
Absolutely.
And I think partnerships in dealing with this disease.
Yeah. Doctor, thank you. Thanks so much for, I think, what's been an invaluable discussion about breast cancer awareness, because it's real. It's very, very real, and it's affecting more and more people. I'm not sure what's going on, but I'm hearing far too many stories of people just being diagnosed with, whether it be breast cancer or other cancers. And you know, our thoughts and prayers are with everyone at this point as we today observe what has now been known as World Cancer Awareness Day. So that's what we're doing here on Morning Live. That was Dr. Renata Maharaj, Head of Medical Affairs for Novartis South Africa. Thank you so much.
Thank you.